So welcome back. It's good to see you again.
Yes, I'm so excited. I am pregnant.
It's wonderful news. I want to go through a few questions and get prepared for the next 9 months together.
Okay, so what do
Let's
I do
just
now?
review the date of your last menstrual period.
I was last month, but I don't remember exactly. Do you need the exact date?
As we get through some of the tests, we'll get the information that we need. So I think that we're okay with a ballpark figure.
Do you know when the baby is going to be born? Like the due date, exactly the due date?
The due date will be 40 weeks from your last menstrual period. So once we have some other testing done, we'll be able to give you a more clear indication of a date.
With all this process, do you know if I need to take shots? How many? How often? And all that kind of stuff because I am not familiar with this process.
That's an excellent question. We'll be able to do an ultrasound, at least one. We'll also be able to tell by the size of your uterus measuring how much the baby is growing.
What does the word uterus means? Because I am not familiar with that word.
On the outside of your skin will measure from your pubic bone up to the top of your uterus.
Is that procedure normal in all the women who are pregnant? Or is just me? And will you let me know if the results come back and there is something abnormal there? Are you going to let me know?
Those tests and those measurements done.
That's interesting.
I would also like to take a blood test today, though, to measure your blood levels, your iron, and to make sure to rule out any infections.
What do you mean by blood levels? I don't understand.
We need to know if your iron is at a good enough level and to see if there are any other infections in your blood now.
Will you let me know if there is anything wrong once the results come back so we can take care of it right away?
Yes, we'll go over them together.
Okay, that sounds good.
Have you been taking any vitamin supplements?
I mean, I eat well, I eat a good diet, but as far as taking multivitamin supplements, I do not. Should I?
Yes. What I'd like you to do, and I'll give you a prescription, is for some prenatal vitamins. They are quite big and difficult to swallow, but important for the health of your baby.
Can I break them in half so I can
Yes.
swallow them easily?
Good.
Okay, fine, I'll do that.
Excellent. How are you feeling generally?
Right now, I am very miserable. I am very emotional. Everything I smell, like the food, the cooking, the fumes, the smoke, everything that's around me is just awful. I mean, I should be in a good stage of my life, but I'm not. I am very unhappy. I mean, is that something that's going to go away eventually, or what's the deal?
What you've described is very common in many pregnancies, and our hope is that it will go away when you're in the middle of your pregnancy.
Goodness, I hope it goes sooner than later. I really can't wait to get off of this symptom.
I'm sure that you do. There are some things that may help you. For example, starting out and having a light meal in the morning.
That's very hard because I really love to eat. I feel like everything I see, I gotta eat it. Now, the only thing is that because of that, I have been having some heartburns. So is that normal or I just need to be patient?
Different people experience different things, but yes, it can be normal to have heartburn. And eating frequently in small amounts may help your nausea.
Okay, that's interesting. I'm gonna try that and see what happens if it works.
As we prepare to wrap up for today, I'll make sure that you have been weighed and that we have that weight recorded.
What is the goal? What's the point of getting weighted every time I come in?
Each time you come to the office.
Let's assume that I'm not gaining any weight. Does that mean that there is something wrong with the baby and with the pregnancy?
Not necessarily. It's just important to see how the pattern progresses over the next few months.
Okay, that's good. Just go ahead and do whatever you have to do.
Aside from the blood test, and we'll also take a small urine sample from you today, do you have any other questions about what you'll be doing before I see you again next month?
Are those tests done every time I come in, or is just a one-time deal?
Only the urine sample each time, and I don't think